As a doctor, I often encounter patients dealing with the discomfort and embarrassment of prolapsed hemorrhoids. Hemorrhoids are swollen veins in the lower rectum or anus, and when these internal hemorrhoids protrude outside the anal opening, they are referred to as prolapsed hemorrhoids. This condition can cause significant pain, irritation, and even bleeding. Fortunately, prolapsed hemorrhoids can be effectively managed with a range of treatments, from simple home remedies to minimally invasive procedures and surgical interventions, depending on the severity of the prolapse. For many patients, conservative home treatments provide significant relief from prolapsed hemorrhoids, especially in mild to moderate cases. The cornerstone of managing this condition begins with dietary and lifestyle modifications. I advise my patients to increase their intake of dietary fiber, which plays a crucial role in softening stools and reducing the strain during bowel movements, a primary factor in the development and exacerbation of hemorrhoids. A diet rich in fruits, vegetables, whole grains, and legumes, complemented by adequate hydration, can significantly alleviate symptoms and prevent further prolapse. In addition to dietary changes, the use of over-the-counter stool softeners or fiber supplements like psyllium can further assist in maintaining soft stools, making bowel movements less painful and less likely to aggravate the hemorrhoidal tissue. Another effective home treatment I recommend is the use of sitz baths. Soaking the affected area in warm water for about 10 to 15 minutes several times a day can provide soothing relief, reduce swelling, and promote healing. This is particularly beneficial after bowel movements when discomfort tends to be at its peak. I also suggest topical treatments, such as creams, ointments, and suppositories containing hydrocortisone, witch hazel, or lidocaine. These products can effectively reduce pain, itching, and inflammation, providing much-needed relief for those dealing with the symptoms of prolapsed hemorrhoids. For immediate pain relief, applying cold compresses or ice packs to the affected area can help reduce swelling and numb the pain. Good bathroom habits are equally important in managing prolapsed hemorrhoids. I always emphasize to my patients the importance of avoiding straining during bowel movements and not spending prolonged periods on the toilet, as these actions can increase pressure on the hemorrhoids and worsen the prolapse. Additionally, responding promptly to the urge to defecate is crucial, as delaying bowel movements can lead to harder stools that are more difficult to pass and can exacerbate the condition. Gentle cleaning of the anal area with moist wipes or a bidet, instead of dry toilet paper, can help avoid further irritation. For patients whose prolapsed hemorrhoids do not respond adequately to home treatments, I often recommend minimally invasive procedures. One common and effective option is rubber band ligation, where a small rubber band is placed around the base of the hemorrhoid to cut off its blood supply. This causes the hemorrhoid to shrink and eventually fall off within a week. Sclerotherapy, which involves injecting a chemical solution into the hemorrhoid, is another option that works well for smaller prolapsed hemorrhoids. Coagulation therapy, which uses infrared light, laser, or electrical current, can also be used to create scar tissue and cut off the blood supply, causing the hemorrhoid to shrink. In cases where prolapsed hemorrhoids are severe, recurrent, or fail to respond to less invasive treatments, surgical intervention may be necessary. A hemorrhoidectomy, the surgical removal of hemorrhoidal tissue, is considered the most definitive treatment for severe prolapsed hemorrhoids. This procedure, performed under general anesthesia, provides a permanent solution but comes with a longer recovery time. Another surgical option is stapled hemorrhoidopexy, where a stapling device repositions the prolapsed hemorrhoid back inside the rectum and cuts off its blood supply, causing it to shrink. This procedure typically involves less pain and a shorter recovery period compared to traditional hemorrhoidectomy, though it may have a higher risk of recurrence. Hemorrhoidal artery ligation, also known as Doppler-guided hemorrhoidal artery ligation, is another surgical technique that involves tying off the arteries supplying blood to the hemorrhoid, reducing its size and symptoms. It is important to seek medical attention if you experience severe pain, significant bleeding, or if the hemorrhoid becomes thrombosed, which means it has developed a clot that can cause intense pain and complications. Persistent prolapse or symptoms that do not improve with conservative treatments also warrant a professional evaluation. In summary, prolapsed hemorrhoids, while uncomfortable, are treatable with a variety of approaches tailored to the severity of the condition. Through a combination of lifestyle changes, home remedies, minimally invasive procedures, and surgical interventions, it is possible to manage symptoms effectively and improve quality of life. Early intervention and adherence to good habits are key to preventing progression and ensuring the best outcomes for those suffering from this common but manageable condition.